we could prevent by healthy diet and lifestyle about 90% of cases of type 2 diabetes.
There is somebody dying of a heart attack every 36 seconds.
Change their lifestyles today to live longer.
We can't substitute for a healthy diet by taking supplements.
We can turn on good genes and turn off bad genes.
Now, if I was taught that in medical school, it would have said impossible. That's magical.
What we see, people think they know, but actually they don't know.
So basically, the health is in our hands. Today, we have more health information than ever before. AI, podcasts, endless expert advices.
And yet so many people still feel tired, inflamed, disconnected from their bodies.
You try control, restrictions, complicated protocols, but instead of health, you feel overwhelmed and exhausted.
We are doctors, and we've seen this again and again. Most people don't need more methods. They need to stop fighting their body and start supporting it.
Through simple, science-backed habits: nourishment, sleep, movement, stress recovery.
Because when you create the right conditions, the body does what it's designed to do best: heal and restore.
Doctor's Mind-Body Reset, a return to your energy, your balance in your life. Good afternoon, Professor Willett. We're happy to see you again here, to meet you here. Thanks for inviting us today here at Harvard.
Nice to have you back in Boston.
We're glad we're here back at Harvard Medical School and Department of Nutrition and Epidemiology, where everything starts. It's like a mecca for every doctor. Let's jump into statistics straight away. And we clearly know we have a chronic disease epidemic worldwide. And I will just give some numbers. So we know 38 million of people, or 1 in 10, have diabetes. 1 in 8 women have breast cancer. There is somebody dying of a heart attack every 36 seconds. And according to recent research, we know that 35% of people have chronic inflammation in their bodies, which means they are in pain or they have lower immunity. Allergies, autoimmune conditions are rising. Actually, almost everybody at some point have like low energy, body aches and different unpleasant symptoms. At the meantime, we have numbers from FDA, and we know that 75% of Americans and 73% in European Union are taking pills and vitamins, supplements, hoping to get better health and to get longevity. So for me, that means that we're missing something and people are doing something wrong, taking the wrong path to their health. So what do you think about this situation?
Well, you certainly accurately described the burden of health, disease, and suffering that we're experiencing as populations. And the important thing, most important thing is that, of course, we will all die sometime and we will have some ill health, but we could add many years of healthy lives. It's really critical to realize that we could add many years of healthy lifespan to our experience if we have a better lifestyle, meaning a better diet, better physical activity in particular.
What evidence do we have so far to support that our daily habits and routine nutrition, stress management really have strong impact on to reduce the risk of chronic diseases and chronic serious life-threatening conditions?
Well, we've looked at many of these questions over the years. We have several 100,000 people that we've been following since the early 1980s, tracking what people eat, tracking their physical activity, health events, diagnoses of cancer, diabetes, cardiovascular disease, and now dementia, and some of the neurodegenerative conditions like Parkinson's disease. And we see that we could prevent by healthy diet and lifestyle about 90% of cases of type 2 diabetes and about 80% or more of coronary heart disease, number one killer in virtually every country around the world. Then I could go on, but the point is that much of this burden of disease and suffering is preventable. And I think we're not taking advantage of that knowledge that we have.
And we have these figures also from numbers from Rybakova, the great study of versus health study, which have been, which it's unbelievable. It has been running since 1976 until nowadays. and you've been leading the study as well since for decades now.
Yeah.
Can you tell a bit more about the study and what the study can tell people and what it can show people? Or maybe it's something which could motivate them to change their lifestyles today to live a longer and happier life.
Yes, the Nurses' Health Study started in 1976, and I was just coming aboard as a doctoral student here at that time, and it was set up to look at oral contraceptive use and breast cancer. So breast cancer has been a focus of the study from the very beginning. And I started looking at smoking and heart disease. In fact, it's hard to realize now, but at that time, it was believed that smoking did not cause heart disease in women. It was part just inadequate follow-up and studies that were too small. In fact, even where I'm sitting right now at the School of Public Health, people were smoking around this table. It's hard to imagine. They can't smoke in the whole medical area here now at this point in time. And we, of course, showed that smoking is the number one cause of heart disease in women. And as I was looking at smoking, I realized that this would be a tremendous population to look at bigger, broader issues of diet and physical activity and beyond breast cancer. And so over the years, we've expanded the study in multiple dimensions to add, starting in 1980, collection of dietary data. And very importantly, we've updated that information on diet every 4 years and physical activity every 4 years as we've gone on. And actually, this is really the only study in the world that's done that. And it turns out it's not maybe surprising, but it's really critical to have that updated information because people change their habits, the food system is changing, what's available is changing, and partly as people get more information, they change their behaviors. So we've been able to keep track of all those changes over time and relate it to these health outcomes. And we certainly confirmed, as we suspected, that heart disease would be affected by diet. But what we've learned is that our diet and lifestyle affects essentially every organ in our body. We looked at the endocrine system, diabetes early on. We've looked at cancers beyond breast cancer. And now as people are getting older, we're looking at dementia and neurodegenerative conditions. And we've looked at vision and cataracts and macular degeneration. Right. More recently, some of our colleagues have been looking at hearing. And I think not very many people thought very much that our diet could affect our hearing, but actually, maybe not surprisingly, we can preserve our hearing much better by healthy diet. That's not too surprising because what we've learned over the time is that there are metabolic pathways that affect our whole body, not just one organ at a time. So what's amazing to me is since we started that, it's not just heart disease, it's not just blood cholesterol and saturated fat. It's much more comprehensive, both in terms of the various parts of diet that are important, but also comprehensive in terms of their impacts on our body. And now, over the last few years, the impacts on our environment and climate change, which ultimately is probably even more important than our individual health because that will affect the well-being of future generations.
Yeah, definitely. And thanks for commenting on this Nurses' Health study. I think it's just amazing, collecting the experience of generations of the whole population of more than 300,000 people through decades. Yeah. And then another question Alexandra has mentioned already about supplements. And this is actually a very important question because a lot of people all over the world, they rely on supplements to get health.
What we see, it's because we work with a lot of people and also a lot of young people. And what we see almost every day, people who know, okay, I want to be healthy. Okay, I'm going to focus on my health, well-being. It's important. What they do, they go and buy a lot of supplements because there are a lot of doctors and nurses and different healthcare professionals, nutritionists who advise supplements not as it's clear if you have iron deficiency, you need to take heroin. It's clear what vitamin D deficiency, you need to substitute. But what they do, they call it like a handful of pills, or instead of healthy plate, they use this handful of pills. And instead of focusing on nutrition, they say, oh, it's better you take, because the food is empty nowadays, better you take all these pills and you're gonna be happy and healthier. So what would you say about it?
Yeah.
So can we substitute?
Sure. No, it's quite clear from all the evidence we have that we can't substitute for a healthy diet by taking supplements. That, as you mentioned, there is some role for supplementation for people who are really not getting enough of iron or something, and for vitamin D. For many people, that's difficult. But we can't, with supplements, really replace the whole plate, because there's so much there in terms of the macronutrients. In other words, the types of healthy fats, the types of healthy sources of protein, the forms of healthy carbohydrates like whole grains. If you put all of that in a supplement, it would end up being as big as a plate. So that won't work very well. I do think there is a role for a very simple, inexpensive multivitamin, multimineral, is sort of a safety net. Yeah, that would include some vitamin D, for example, that is hard to get in a northern climate where we live in the wintertime, especially. That's, again, just the sort of usual daily requirement of basic minerals and vitamins, including some that are hard to get, like vitamin D. But that doesn't at all replace a healthy diet. That's sort of putting our fingers in the dike, say, of to correct anything where we might not be getting quite enough. Because we also realistically, not everybody can eat a healthy diet every meal if we're busy at work or traveling or things like that all the time. But the bottom line still is supplements can't replace a healthy diet.
Yeah.
Thank you for saying that. That's so important. Yeah. And what I think important people don't understand, they focus on certain vitamins or minerals. They know, like, okay, they know about zinc or whatever, but they don't understand there is much more in the food that are like thousands of phytonutrients, and you can't replace them.
Oh, absolutely. We do have well-established data on essential nutrients. There's a few dozen of those, but what we're seeing is that there's much more to foods than what we call supplements that we might put in minerals and vitamins in the supplement capsule. And we're still learning a lot about the phytochemicals, as you say, that are in foods that seem to be very important for their properties for maintaining health, but not in our textbooks as essential nutrients.
Yeah. And then having said all that, and we have the data that supplements cannot substitute the diet and other lifestyle choices. What would you name the strongest lifestyle choices which will give the real health and which will prevent diseases, chronic diseases, and possibly even reverse some chronic diseases? Probably if you would name three, the most powerful ones, which come from research and even from Nurses' Health Study.
That's a hard question, and I can't really quite answer it, but because I think diet is like an orchestra, that we need all the parts, all the instruments, and we need them in the right balance, or it isn't going to work right. But I can name a few areas where where they're very important, and many people are far from where we should be. And that one would be, first of all, the type of fat in our diet. That when we started our work, it was believed that all fats were bad. But what we've come to realize, and actually the evidence was there, but people were ignoring it even in the 1980s, that unsaturated fats are beneficial. We knew at that time they would help lower blood cholesterol. And by unsaturated fats, mainly the liquid plant oils like olive oil has been around for a long time, but soybean oil is very good, rapeseed oil is very good as well. They actually will reduce blood cholesterol levels, but a lot of saturated fats are bad. And trans fats are really bad. Fortunately, in Europe and the United States, they're now banned in virtually all countries, so we don't have to worry about that. But we've also realized that even these healthy plant oils, it's probably more than just the type of fat, but some of the phytochemicals that are in the plant oils are also beneficial. And I think it's useful to think about the seeds that were the source of those unsaturated healthy oils, because seeds are really pretty amazing, that inside that seed there is a living embryo, and that embryo can exist for several years just sitting there on a shelf. And then if it gets the right moisture and the right temperature, it can sprout and become a plant or a tree. But during that time that seed is sitting there, that embryo has to be protected from damage. And so it's packed in oil, which keeps the oxygen away, so there's no oxidative damage. And then there's all kinds of antioxidants in that oil that, again, protecting that embryo. Then when we consume those oils, it looks like those protective factors are actually helping us protect our own tissues as well. So definitely they're lowering our blood cholesterol levels, but also it looks like they're helping protect our tissues at the same time and having other critical biological functions.
Amazing.
Yeah, it's interesting. We have this nutrition as a fundamental tool for lifestyle medicine.
Yeah.
And it gives so much effect. We just discussed with other doctors in the meeting. But why don't people use it as a main tool?
Well, that's a very good question. Why don't we take advantage of all the information that we've acquired over the last few decades? Some of it is just, I think, inertia that it's hard to change behavior. It's hard to change thinking over time. Maybe we're not, as humans, not very well adapted to that. But there's also powerful forces, too, that including the pharmaceutical industry is very invested, spend tens of billions of dollars a year developing their drugs and marketing their drugs. And so they're and obviously making huge profits, where the food industry can't patent an apple or can't patent an orange in the same way that a pharmaceutical company could. So they don't have those really excessive profit margins that the pharmaceutical industry does. And then another problem is that the faculty, the teachers in medical schools teach what they were taught. And in fact, they don't know about nutrition, and so they're not going to teach it to their medical students as well. So again, that's part of the inertia problem. And I think we do need to work at all levels here, getting better instruction, education into medical schools, into postgraduate programs, the training of interns and residents. And also, like you're doing, I think we can't wait for all of that to happen. It's really, we have to educate the public more directly as well. In the long run, of course, that will continue to be part of it, because our doctors and our nurses, our other health professionals should be providing this information. They're in general not. But even so, the public needs a reliable source of information. There's too much misinformation out there.
Exactly. That's a huge problem, misinformation. Oh my God, it's such a shame, because as I said, some people, they understand, wow, food is important. They go on a search online, wherever, or they go to nutrition specialists, and then they get misinformation. Somebody will tell them, oh, protein is so important that you need to eat meat 3 times a day, otherwise you will die of anemia. This is what we're seeing. Or they will tell like, oh, don't eat fruit because all fruits are bad, because fructose is bad. So they don't understand the difference between fruit and fructose. And this is just so painful. So what do you think? How people can rely on this information, how they can find the right practitioner, or where they can go online? How do they understand whom to believe?
And the right source maybe as well.
Yes, it's a huge problem. I'm not a psychiatrist or psychologist. I don't fully understand all of this. I think there is some attraction for having something novel and new. Oh, this is going to solve all the problems. Or there's also, unfortunately, even in the more establishment media, writers for newspapers or television or other online sources of information, they're all competing with each other to attract viewers. And you attract viewers by something that is, everybody got it wrong before. Here's something new. Here's the ultimate answer. It's not as exciting. They won't attract as many viewers saying, oh, this is a 20th study that showed that high regular consumption of whole grains will have major health benefits. That's not so new. And so I'm afraid that we are in some ways we as people are addicted to looking for something new that is flashy and attractive. Our information is sort of new, that it's not always taught in medical school, but it's It's not that sensational thing that's going to solve all problems, which will attract viewers. And of course, there's so many different sources of media now. They're all become, even the medical journals are falling into this trap too, of trying to have sensationalist new findings that are the least reliable kind of information. You really want information that's been confirmed by multiple studies, undergone rigor, critical review by the review system that we have in place. And that's in general not what's being even published in the medical journals. They want the first study, not the third study, which is, in fact, the third study that supports the previous studies is what's really going to be the most reliable. And that's where we should really be teaching that and conveying that information and putting it into practice.
So using cherry picking. Some do cherry picking and they pick a study, and then there was a study about meat, and we saw the response from Harvard School about meat, and then they concluded suddenly after the decades of tons of information and evidence that you can eat meat every day, 3 times a day. And then it's unbelievable. And then media, it spread in media within days and weeks.
That was really, in fact, another journal did come up and say this is editorial irresponsibility or editorial malpractice, that this journal, a medical journal, usually credible medical journal, published this and then put out press releases about it, again, to be sensationalist, attract readers and get clicks and that kind of thing. That's not the right way to convey solid, really evidence-based and confirmed scientific evidence. And of course, we're all in the business of doing new, learning new things, but those new things are important, and that's how the process goes forward. But the scientific process really requires confirmation, and that's been a part of the process that maybe not as exciting as the latest new finding of the ultimate solution, but in fact, most important.
I find it's very exciting because, we teach people and healthcare professionals, we teach nutrition and lifestyle medicine, and we are very proud actually that we rely on you, on your research, on Harvard research, on lifestyle medical research. So we know it's true. So we are not harming the people, we're helping people. And so that's why when I see, other professionals telling bullshit, so it feels very painful for me. Yeah.
It is painful, as you say, to see people actually harming themselves. There's this, one of the lines of information, if you go to the internet, is that seed oils are damaging. And omega-6 fatty acids are dangerous, or that we should avoid all types of fat in the diet. Still, that was what people thought 30 years ago before we had good evidence. And people can actually harm themselves by giving up some foods that are healthy, and of course we're going to all eat. So instead eating something that's less healthy for them.
Yeah, and for general public, we know, we see, you've got a website as well where you discuss quite clearly things for general public as well, like what to eat and is meat good or not good for health. You discuss the healthy plate. Would you advise or suggest usual people to go, for example, online and go on your website and just search and maybe to find clear answers how to improve their health and to keep themselves young and full of energy? Or what would you recommend? Because a lot of people just read news or medical news or something like that. What do you think?
Well, we do as a department have a website we call Nutrition Source. And we do try to put on that information that is solid and is based on a lot of evidence. So I would certainly encourage people, if they have a question, to look at the website. Now, we may not have the answer to every question, and we certainly don't pretend we have the answer to every question yet, but I think we have a really solid basis, a good view of the big picture of what a healthy diet is. There's still details that we're studying, working out, or adjusting a little. Maybe you need to adjust the amounts a little bit here and there. So it's not that we're not continuing to research or learning, but there's a lot we have learned, and even just following what we have learned again, we can see that we can help people live a decade longer than they were in a healthy decade longer, not just an unhealthy decade longer, by diet, lifestyle, and that can make a huge difference. So I do think that's a conservative estimate. I'm pretty sure we can stretch that beyond a decade longer, maybe by even better adherence to what where we see we should go, and we'll probably learn about some more details. But
and what's very inspiring to me, that we cannot even help people to live longer, but we can even help people to live better life, better quality of life, because what we are seeing with other people, with our people, like within a couple of weeks, only food intervention, they get rid of eczema they had for their whole life. They get rid of acne very often. GI symptoms go away. They lose weight, not in a couple of weeks, but in a couple of months. Overweight without dieting, like the inflammation improves. So we have patients who got rid of, for example, rheumatoid arthritis, even children. So it's so impressive that you can affect like people's health, overall health, like every organ and every system in our body you can affect by just doing one thing right, like nutrition. So maybe you can explain how it works, because I call it magic from science. Yeah, because it looks like a magic. You just change your diet and everything improves, like everything. So why is it happening? What's the mechanism?
How does it work at cellular level and at gene level? Because we know it's not just a food, it just works within.
Yeah, well, we don't totally understand all of how it works, but what you're describing is what took us about 30 years to learn ourselves. That we started off looking at what would help heart disease, and that was a good target. But then we started to realize that people having that overall dietary pattern, they had better function of almost every part of their body. And again, we're still learning about that, but diabetes risk goes down, weight control, it became much easier. Well, I mean, some people have such a genetic predisposition that that won't totally control their weight, and they may need some help with some medication, and some of the newer drugs are more effective. But the vast majority of people can have a healthy weight without those medications. And we don't need our evidence to show that, because we didn't have it 50 years ago. No. There were about 10% of people who were overweight or obese at that time, and even not everybody was on a healthy diet then for sure either. So we could just see what's happened in the last 2 decades. It's not genetic or inevitable that we have these problems that we do today. But again, we've seen that this overall healthy dietary pattern will have benefit across the board almost. And again, we first were thinking mostly about lowering blood cholesterol levels. And we knew even in the 1960s that changing the type of the fat in the diet would improve the blood cholesterol levels quite dramatically. But we've seen that other components of the diet can add to the reduction in blood cholesterol levels. The type of fiber can help that too. But what's become really clear is that there are many other pathways that can lead from a healthy diet to better health outcomes. Definitely, as you already mentioned, that healthy pattern will reduce inflammatory factors in the blood. It will help protect our cells, the DNA in our cells, from damage, because it will include antioxidants in the diet that are not counted as a mineral or vitamin. Not only protect our DNA, but help in programming the DNA. And that's been a very interesting area. It's a hot topic at the moment, that our genes that control essentially the development of our body and the functioning of our body can be turned off and on. It's like they have a switch on them, and we can turn those switches off and on by diet. And probably really what was so striking early on was the relation between folic acid in the diet and birth defects. And the most common birth defect in this country, and I think in Europe as well, was the group called neural tube defects, like born without a brain or defective spinal cord. And we showed, and then it was confirmed by randomized trials, that folic acid would, just that simple vitamin that you could get it in a diet, or as, again, this very inexpensive pill, could reduce the prevalence of neural tube defects by about 60 to 70%. Now, if I was taught that in medical school, it would have said impossible. That's magical. It can't happen. Just that little bit of extra folic acid, almost microscopic amount of folic acid, could do that. And it's not by changing, preventing a mutation. It's by turning the genes off and on at the right time during fetal development. And that is a particularly striking example, but it looks like we can modulate or turn off and on switches to control our genes and how they result in production of RNA and then proteins that control our metabolism. And we can do that by what we eat. We can have a profound effect that way. Also, in more recent years, we're learning that the microbiome has a major effect on health. And this is interesting. We're doing a lot of work, and other people are as well in this area, because we now have the technical tools to actually identify the bacteria, the viruses, fungi that are residing in our colon. And we actually thought about that in the 1980s, but we didn't. To do that kind of study, you needed to have fresh fecal samples and culture them for hundreds of organisms all at the same time. It was just not practical to do that kind of study. But now we can just take a little tiny pea-sized amount of stool and subject it to genetic analysis and identify 1,000 different organisms that are there. You don't have to grow them. You can identify them by their genes. And now we can see how those are being part of the picture of how our diet, our diet is the diet of the organisms that live in our colon. So that determines who's living in our colon, basically, and what they're doing. And it looks, again, we're, I think, just starting to understand this, but so far it looks like that is an important way of influencing our thinking, our depression, and the degeneration of our brain.
Yes, yes, and we know there is a link between gut and the brain, and even we do studies because we have a lot of contact with a lot of our people, so we have results from thousands of people, and we do our own research to see what's happening there. And we did recently a research when people change their diet drastically, according to science, including variety of plants, because people don't get
food for life.
Because people don't get enough fiber and don't get enough the plants in their diet, and then once they go into completely plant-based diet for 2 weeks, they transform completely. So we use a promise turn questionnaire just to assess the mental health and physical health. And just so you mentioned about physical and mental health too. And only after 2 weeks, their mental health improves significantly. So less stress, less anxiety. So it's unbelievable. So just only one intervention and no meditation even, no physical activity, only one intervention, powerful nutrition changes everything.
Again, when we say microbiome is important, there are guys coming in from industry and saying, okay, we have probiotics for you. Prebiotics is better. Take this as a medicine and it's going to solve all the problems. So what would you say? Can we again rely or diet is first?
Yeah, absolutely. Diet is first. Now, we know that diet is very powerful, and it's always been so. We didn't have these supplements before. And again, we're still in a learning phase here. Maybe if someone can't follow a diet for one reason or another, that some of these supplements might have some impact, but I suspect they're not going to have nearly as much impact as diet. Partly, even it's just the amount. Again, to have the full impact of that whole plate, it's probably just physically not possible for a small supplement to have the massive impact that a whole healthy diet has.
Yeah, it's so important to know.
And many people think they know that they eat a healthy diet. We know it from experience. They say, oh, I eat healthy anyway. Let's say I was consulting a nutritionist. He said, eat more vegetables, fruit, meat 3 times a day, and fish for omega-3s. But they don't get any results. They don't get any good results for their health. They don't get any good transformation. Once they go on proper scientific apparent diet, which we call planetary diet, or we call it food for life, anyway, or with a variety of plants, they get the real results.
Yeah, the problem is that people think they know, but actually they don't know. And so they're, again, going the wrong path because they may listen to us and think, okay, more veggies. Okay, that's clear. That's what I'm used for all my life. It's so simple. But they don't understand there is a system. So it's not just about eating more veggies. You need to know like what type of protein, how much protein, fats are not all the same. Carbohydrates are not the same. You need to know how to combine food. And if you have the disease, then you need to know all these small important things which will make a difference so you can get better. So I think very important that people understand, yes, diet is a magic tool and it helps a lot to prevent diseases, even to reverse a lot of chronic conditions, but you need to do it in a right way.
Yeah. Well, I think the reality is that most of us growing up in the U.S. or Northern Europe never really experienced a healthy diet.
Yeah.
That's the problem. And so it's not surprising that people might think they're eating a healthy diet because they never knew anything different. That's how I grew up, actually, in Michigan, in the center part of the U.S., which basically sort of inherited the diet of Germany and Holland and Northern Europe, which was a diet that I can understand, but that's how you survived in cold climates where you didn't have a chance to have vegetables and there wasn't transportation or preservation of food. So an animal source diet was a way to survive in that hostile kind of environment. You could make your cheese in the summer and have it in the winter and kill your pig in January and have sausage and things like that to preserve foods or and preserve things with a lot of sodium in it. But yes, that will help us to survive to age 50, but that's not what we want. Now that people would like to have a longer life and have good function and be healthy for years longer. And it is partly new knowledge, but I think we have to acknowledge too that the transportation that allows us to move, having local foods as much as possible is definitely advantageous, but in a cold climate, that's not always going to have fresh fruits and vegetables available. And having preservation methods that are refrigeration does help have fresh foods along most of the year. So I think it's partly a healthier diet came more naturally to the Mediterranean countries, and we've learned a lot from that because the climate supported that kind of diet in a much better way. And you could have olive oil instead of butter and lard, which clearly makes a big difference in long-term health and well-being.
And let's talk about meat and beef. Every time when on social media, I say like, if you feel sausages every morning to your child, it's not going to help him to be, healthy. It's a known cancerogen. And every time I get response from people, what? It can't be true. You're lying and stuff like that. So let's make it clear that we have a lot of evidence and we know that it's not very healthy, to eat sausages in the morning and then feed it to their child, and even red meat. So would you comment on it?
Yeah, definitely having sausage for breakfast is not going to be a healthy breakfast. And we have lots of evidence to look at amount of animal source foods. And we do see that it's not necessary for everybody to be a vegan, but definitely having most of the protein sources coming from plants is desirable for not just heart disease, for cancer, for function. We published some guys are interested in erectile dysfunction. And we see a more plant-based diet will delay erectile dysfunction as well. As just one example, but every organ is connected. We're looking at what we call healthy aging, which means not just living longer, but having better cognitive function, better brain function, better physical function, and not having a burden of chronic disease. And what we see very clearly is having less red meat and more plant-based alternatives such as nuts, legumes, soy products is clearly advantageous. We see that a small amount of red meat is okay in general. Now, what we see is probably a good target is about one small serving of about 100 grams once a week would be a good amount. And that's what people ate in a lot of traditional diet areas, like Mediterranean diet, for example, was about that amount of red meat. Or if you're like a big serving for holidays or special events or something like that, but not as an everyday
But if people don't like meat, for example, do they have to consume red meat in order to get enough iron and to stay healthy, or they can still replace with other sources?
Yeah, definitely red meat is absolutely not essential. That you can get enough iron from purely plant sources. I do think, though, that people do need to be aware, if they want to become a strict vegan, that they will need to have some extra, vitamin B12 in particular is important. But again, you can get that from just a very inexpensive multiple vitamin that here costs less than 10 cents a day. That will give plenty of vitamin B12 and all the other B vitamins that you might be getting. So I have in our big international analysis, we went through a massive amount of literature to define what a healthy diet would be. And we have lots of numbers, lots of analyses. But in the end, it comes down to something pretty simple, which is 1 + 1.
Yes,
exactly. Yeah.
Simple.
I love this. I always teach people on the program on Food for Life, 1 + 1. That's from Professor Willett. This is you can't forget it. That's so easy to remember.
Even if our cognitive function is going, we can easily remember 1 + 1. Which is about 1 serving of dairy a day, and 1 serving of other animal sources of protein per day. And in general, emphasizing poultry and fish, but keeping the red meat to about once a week is good. But that gives a lot of variety, and it's very consistent with a lot of most traditional diets around the world that had small amounts of meat. And it's interesting as we look at the international patterns that, of course, much of the world has no dairy consumption at all. And in fact, colleagues in Indonesia, it's interesting looking at their national dietary survey, virtually zero consumption of dairy. And the average intake of calcium is about 250 milligrams a day, which most nutritionists would say that's just extreme deficiency. But they actually have the lowest bone fracture rates in the world. And it's very low. I'm not recommending that everybody should avoid dairy products in general, but if you don't want to have dairy products, clearly you don't have to, and you can be healthy. I think I'd like to see calcium intake be higher than 250 milligrams a day, but there's lots of ways to do that.
Exactly.
Yeah, going through our conversation, there is a clear clear topic which is coming through. With literally, we have to have a variety of plants, which are packed with phytonutrients, antioxidants, which repair these genes, work at cellular level to get our health in shape, to prevent chronic diseases, and not to concentrate on some magic pills and supplements, and maybe to spend more money on berries and on leafy greens. Especially you mentioned about dementia, and numbers are rising now as well. The dementia, cognitive decline, so people get older and suffer a lot. There's actually a major cause of death nowadays as well in the US. And talking about mind diet as well, which is was designed and described in Harvard as well. And the 2 things which make big difference are berries and leafy greens. Would you comment on that as well? And it's unbelievable which 2 things, adding to the general healthy diet, Harvard diet, can significantly impact the cognition and mental health.
Yes, absolutely. And it's a lot of this is happening, as you say, the berries and green leafy vegetables seem to be very important. And it's interesting that in our diet here, I don't know about where you are in Germany, but about half of the people in the U.S. have almost no green leafy vegetables.
Same. In Germany, it's better, but as we work with a lot of Russian-speaking people all over the world, yes, they're not eating leafy greens at all. Because when you call it salad in Russian culture, salad is something like, like potatoes, mayo, and stuff like that. Yeah. They're not meaning like leafy greens. Yes. It's horrible.
Yeah. So it's a big hole in the diets of many people. So that's really important. And we also see that those are important. And the berries, of course, have lots of phytochemicals in them that look like they have really important functions in terms of maintaining health. Also, the carrots and the dark yellow vegetables seem to be, I think, very well established as important in maintaining cognitive function. And actually, there was a big trial done here at Harvard for actually not looking at cognitive function, but it was a beta carotene pill versus a placebo. And after about 15 years, there was better cognitive function in the group that got the beta carotene pill. Now, I'm not suggesting that people should have beta carotene pills. You don't need to. You can easily get that from a carrot a day.
But not only an apple a day, but also now a carrot a day.
Right, yes. Yeah.
Takes the doctor away.
I literally think that's a good idea. And the nice thing about carrots is they're not expensive.
Exactly.
They're inexpensive. In fact, carrots are one of the vegetables that are available with a cold weather climate that my grandparents on a farm would have the carrots, and you put them, we called it a root cellar underneath the ground.
Yeah.
And so they can stay available all year long, even in a cold climate. The carotene, the beta carotene that makes the carrots orange, in fact, does look like it is helping preserve our cognitive function. So there's no just one magic nutrient. It's having these multiple phytochemicals, multi-nutrients that really provide the best overall impact.
And they work at different levels.
Yes, right.
Gut, microbiome, genes, cellular level, and directly on the brain. Yeah, so it's unbelievable. Because I think describing that, what you're just saying is it must leave a significant impact on people's life. And I'm sure after watching this interview, people will have more understanding that to spend money on more quality food, to pay attention on their food plates, for kids as well, rather than buying monthly some magic pills without even a clear, significant evidence.
That's absolutely right. And I wanted at one point that, I don't know how much things cost in Europe, but it doesn't have to be a really expensive diet either. That there are a lot of vegetables that are not expensive, like carrots being one. Actually, cabbage it's interesting that's one thing that was good about the northern European cold weather climate was cabbage.
Yes, we ate a lot of cabbage because so many grandparents they grow cabbages and then and then they give it as a present. September, October they give it to everybody, and people eat only cabbages and not on them.
Yeah, well, it's interesting that it's almost a lost vegetable here in this country. That people maybe just because it was cheap and it was available, have forgotten about cabbages, and we got interested. Well, we've been interested partly because of the basic science work that suggests that some of the phytochemicals in cabbage could be good, but also it was very interesting that Poland had very low breast cancer rates, even when people came from Poland to live in the United States. And so one of my colleagues, Dorothy Panic, set up a study here that we published. She started it 30 or 40 years ago, just published it recently, but confirming that, and we see it in our Nurses' Health Study colon too, that there is less breast cancer incidence with regular cabbage consumption.
Alcohol as well. It does have impact on breast cancer. Alcohol consumption.
Yes, right.
Negative.
So the cabbage actually seems to be beneficial.
Yeah.
And I guess the point is that's an inexpensive vegetable. That's widely available, including that in the mix. But again, there's no one magic source. Also, the yellow squash, winter squash, we call it, is dark orange, and that has lots of carotene in it. So, although, again, a missing piece in many people's diet is the green leafy vegetables. And it may be because some of those would be harder to have available in a cold weather situation, but now we can grow them in greenhouses or some short transportation methods. So that is a really important part of diet that's often missed out.
I think it's all about knowing what's important for you. So if people know that's important, they will, make some movement and fight it and spend some time and money, or maybe they will take time now and go through education so they can learn more about nutrition as far as they understand how important it is. So this is the main thing. And what we told today, basically, I just want to make it clear one more time that we have our genes from our parents, grandparents, and so on. And maybe we have some predisposition for heart attacks, diabetes, obesity, but it doesn't mean we'll get the disease. And what we eat and our lifestyle is the major the major thing. So we can turn on good genes and turn off bad genes only by good variety of food, of a healthy diet.
So basically the health is in our hands.
Yeah, very much so. And of course, I know you talk about it too, the physical activity part goes along with it. We have the regular physical activity together with a healthy diet, then we really get a huge benefit.
Yeah, that's amazing. Actually, what we do, so we teach nutrition to people. This is what I call food for life. And why I call it food for life? Because, I wanted to show people like the one thing, it will change their lives and bring life back sometimes, because when they get rid of the disease, their life come back. And other thing, to show that there is no magic diet. It doesn't work like you go on a diet for a couple of weeks and that's it, and then you go back. So you need to be consistent like for all your life. So that means you need to find the way you eat, which is tasty for you, which works for you. So it's consistent for you for the whole life.
I like that. Food is life. Actually, here people are talking about food is medicine, but actually food is life is better, because medicine sounds like something you take when you get sick.
Exactly.
And definitely we want to prevent the sickness in the first place. And if you get sick, food is still really important, but both is better.
Professor Will, let me show you something, because we are very proud of our people and us. And I have saved just a couple of people, and I want to show you people's results when they just change the diet. What happens to them? I just want to show you. For example, this is the girl. She was 6 years old, diagnosed with rheumatoid arthritis. Her mom is a pediatrician. So mom came to us, she learned about nutrition, and then within, I think it was 4 or 6 weeks, the swelling went down. And then by the end, she ended up running marathon. So now she's get rid of this disease. And this is just
and she
amazing.
was told it's impossible. She was on methotrexate, on the medications, and then inflammation didn't go down. So once she used this transformed nutrition only diet, it transformed her life, and now she helps us. She's one of the doctors which brings nutrition.
And that's her mom. That's her mom who came to us, and she lost like 10 kilos, and she cured her hypothyroidism. So without drugs, and now she doesn't need any drugs. Like this is the lady. She cured 13 diagnoses with only food intervention within a couple of months. And this is so impressive. So you see, there are like,
different people.
Different people. Like
they transform their lives completely.
Everything changed. Like
her mom, I spoke to her personally. Her mom went off all tablets. 75-year-old, goes to gym 5 times a day now. Diabetes reversed. Hypertension went down from 200 systolic blood pressure to normal 120. Can you imagine what powerful tool these people have? And all your knowledge. We're so grateful that you invited us and you share this knowledge with the world and with people. Is so important. That's why we're showing these pictures.
Thank you.
Because we deal with these people. We see a lot of them on a daily basis. You can show
even this man. He's 36 years old. All his life he had such a bad eczema.
30
Within
years.
4 weeks, it's all cleared up, and now he doesn't have it.
Nutrition. Creams,
so
medications
powerful.
didn't help.
So thank you, because I can't explain how with such an open heart, we're so thankful to you for everything you are doing, because you have changed our life first within our family, and you inspired us to go further. So we go away from hospitals now because we couldn't work anymore, with this approach. And now we are trying to educate people and doctors and so on. And this is so important. So we just appreciate a lot everything you're doing.
And look at this lady. She was like 160 without medications, without drastic changes. Now she's very active. That's her.
Without diet.
After a few months, after strict diets, just lifestyle intervention and proper nutrition according to science. That's amazing.
Yeah, it is. Of course, we understand that every person with rheumatoid arthritis will get it totally reversed, but clearly, some people can, and almost everybody will get better to some degree. And it can happen very quickly too. That's one of the things that when I first published the book Eat, Drink, and Be Healthy in about year 2000, that our data, we're really focusing on prevention of heart disease and cancer decades in the future. But all of a sudden I got all these letters and emails saying, oh, thank you so much. I feel so much better. My cholesterol's under control. My blood sugar's under control. I didn't have to think about it, but I lost the weight I was trying to lose. A lot of people were just fighting against their metabolism, going on low-fat diets and eating lots of bad carbohydrates, and really causing a bad metabolic situation. So it does. We're still learning a lot about how. I can't say honestly, I don't know why the eczema is getting better, except that we are.
I think it's through microbiome. I think it's through microbiome and inflammation response, and it's not just getting better, it goes away.
Definitely inflammation markers will go down.
Yeah.
There's still a lot to learn.
We're seeing this every day, There are like thousands and thousands of patients. And we're seeing this every day. That's why I call it magic from science.
Yeah, right.
Because it looks like a magic. We're so inspired. We're just big fans. And also, we have brought you something. Let me. Last year, we went and spent some time at your lovely house, and we saw you have very beautiful books over there, and like different statues from all over the world. So we decided to bring you something, as we mainly work with the Russian-speaking people. And this is the matryoshka. So basically,
I saw it when I was in Moscow.
That's nice. You can open it. It will be like,
there's lots of little dials inside.
Yeah, it's a handcrafted. But basically, it's like a symbol in Russia. This is a symbol of happy and healthy woman, because you see she's like shining. So this is just for you, just so you remember how much you have done for us and for all Russian-speaking people.
Can I open?
Yes,
of course. You can open it. Yes.
Okay, all right. Okay. I won't open all of it.
Yeah. You can see it's so exciting. Yeah.
Oh yeah.
It's even smaller and smaller inside.
Like a symbol of beauty and transformation.
Yeah.
I was in Moscow and Perestroika.
Yeah.
A very good time to be there.
Yeah. Historical.
Yeah. Oops. These are amazing. It is.
So this is also.
Is that the last one?
Yeah, I think so.
Yeah, I think that's more.
That's okay. No,
it's also amazing. A symbol of like woman giving a birth, and because it's not only about one person. When you change your diet, the way you look at nutrition and lifestyle, it's for generation. That's for you, for your children, for your parents. And nowadays we know, thanks to research, that you can change your genes and you will transform these better genes to your children.
Yeah.
So
it's very clear there is this,
So our habits affect not only us, but health of generations. That is,
thank you. This is very special. Yes. That's very neat.
And there is something else for you also.
Oh my goodness.
It just
for better health as well. Antioxidant. Which also Turkey as well, and
from Turkey.
Okay. Yes, that's Turkish organic tea. And organic syrup.
Packed with antioxidants.
Yeah.
Well, thank you. Oh, yes, definitely. I like green tea, actually.
Yes, that's what I thought. I said, Alexandra said,
it was for herbal tea.
It's herbal. I said, no.
I feel.
That's from Turkey as well.
From Turkey also. This is made of olive oil.
Oh, well, thank you. Well, that's good.
You like olive oil as well?
Yes, right. That we consume a lot of olive oil in different forms. Thank you. That's so nice.
And what we hear today is amazing. What the medical students are taught as well. This crucial, they get crucial tool. Yeah. The main tool is nutrition early in their career. We didn't have that. Yeah. And it's amazing what you're doing, that you educate in the early stages of their careers.
Yeah, that's it's really important. Actually, it's something that as we saw the information coming in, that was part of the vision too. But the physician should have it, and it's really grateful that David Eisenberg and Steve especially, he really gave up his career as a cardiologist to focus on this, so it's actually happening. And well, like you are, to redirect his medical career in a way that will fill some of these gaps that are huge. It's the potential for better health is huge. We're just not taking advantage of that. And I am doing a lot of my work on environmental impacts too, but also we can create a better environment in so many different ways that will be self-reinforcing.
That's another very important topic, and I hope we can talk about it next year. So let's make it a good tradition.
That's okay. Yes,
Thank you very much.
We've been working on Cambridge, where we live, and making that more friendly for bicycling and walking. We actually are transforming Cambridge in a pretty big way. Because actually in Europe, we have really good examples, and especially in Denmark and Netherlands, and other places too. So
exactly,
and that's we're trying to catch up. That's Mario. But we're making progress, but we have a long ways to go.
Yeah.
Okay,
we can't hold you anymore. Thank you very much.